We're going to go over now some of the primitive reflexes that you may or may not get asked, but they may be asked specifically or again placed in the stem of the question. That's how that you're going to see them. These are the primitive reflexes. Some people will call them present at birth. Most of them are present at birth, and most of them disappear by about 4 months of age. Of course, there's a couple of exceptions that we're going to go over. The palmar grasp, also known as a plantar grasp, is if you put your hand on the baby's, your finger in the baby's hand or an object, the baby curls its fingers or its toes like it's going to grab something. Again, if you have to guess, it's present at birth. The rooting is if you stimulate the baby's cheek, the baby will turn and open its mouth as if to latch on to the breast to feed. Certainly present at birth and tends to fade away around 1 month. The Moro or Moreau response is also known as a startle response. That is where the baby is startled, and the baby can be startled by either tapping on the exam table or gently letting go of the head, and the baby will then move its arms towards the midline, draw its legs up, and its toes will fan out. This is also present at birth, disappears by 4 to 6 months. You can see a pattern developing here. These are all present at birth, and usually if you have to guess 4 to 6 months. The tonic neck reflex, we'll show you a picture shortly. The baby, when it's laying on its back, will have its head to one side and will have the arm on that side extended, and the other arm will be held up behind its head. They call it the fencer's pose. So the baby will kind of be laying on its back with this arm extended this way, the head will be tilted that way, and the baby's other arm will be like this. If you take the head and move it to the other side, then the baby will go like that. It's called the fencer's pose of the tonic neck reflex. Present at birth, goes away around 6 months of age. The Babinski takes a little bit longer to go away. The Babinski is if you stimulate the baby's sole of the foot, it will then draw its leg up and the toes will fan out and withdraw. It's present at birth, usually goes away around 18 months of age. If it returns, then you have to be very suspicious for upper motor neuron lesions. The parachute is the one that's not present at birth. This is the one where the baby will be anticipating that it's falling. If you take the baby, put it in the prone position and kind of move it forward a little bit, the baby's arms will go out in front of itself to kind of prevent a fall. It will not be present at birth so the baby can tip over. It usually does not go away once they get it. It usually appears at around 6 to 8 months of age, and you shouldn't lose it unless like your blood alcohol level is high or something and you trip over and you fall. So here are some of the examples. This is the Moro reflex. You can see that the baby is moving its arms upward, it's drawing its legs up, and the toes are starting to fan out, also known as the startle reflex. The rooting reflex, the parent or the examiner has stimulated the side of the mouth and the baby is turning its face to that side and opening its mouth, attempting to latch on to feed. There's the Babinski. You can see the toes definitely drawing out and fanning outward. This is the one that usually goes away around 18 months of age. And here's a palmar grasp. You can see that the baby is holding on to the examiner's fingers right there. Couple more, that's the tonic neck, the baby to one side, and this arm will start to extend outward, like I said, the fencer's pose. This is the walking or stepping reflex. I hadn't mentioned that one earlier. That one is present at birth, goes away 4 to 6 months. And basically what happens is when you stimulate the top of the foot by moving the baby so that it's, the foot rubs up against the exam table, the baby will lift its foot like it's going to take a step forward. It's called the walking or stepping reflex. Okay? And this is the parachute reflex. As you're putting the baby down, it's going to be extending its arms. Now, developmental milestones, again, the way that you're going to be getting these is typically you're going to be getting a description in the text. And you may be asked to identify the age of the patient. How old is this patient? Remembering that there's a spectrum of normal. So they're not going to have you tell the difference between a 3-month-old and a 3.5-month-old. But certainly between a 4-month-old and a 6-month-old, or a 6-month-old and a 9-month-old, or a 9-month-old and a 12-month-old, there are certain things that those babies do that are different from the other age groups. And again, the other way that you might get that is in the question, they will mention certain things and you'll have to say, well, child this age doesn't do this or should be doing something else by this time. There's something wrong here I need to evaluate. So we're going to go through some of the things that the babies do. And my best advice to you is just pick out a couple of things in each age group that stick in your mind that will differentiate it from the other. Don't memorize everything, that's crazy. Just try to pick out a few things in each age group that stick in your mind. So in the newborn, we're going to go basically 0 to 3 months. The newborn will turn its head when it's placed on its stomach. The newborn will be able to turn its head and move it over to the other side, and at the same time it probably rubs its nose on the exam surface. It doesn't really clear its head quite comfortably, and it can sometimes rub its nose on the exam surface. If you hold the baby in what's known as ventral suspension, the baby pretty much forms almost like a horseshoe in ventral suspension. If the baby is placed on its back, it's pretty much flexed just like the newborn when we discussed a term baby. And visually, it'll prefer the face. A newborn usually sees anywhere from about 9 to 13 inches. So you need to get close to their faces, and you like to look at other faces. At 1 month of age, the baby will be able to turn its head and be able to clear its nose when it turns the head from one side to the other. That's a really good response to have initially, because that way you don't get your baby doesn't get its face placed on the ground, straight on the exam surface and suffocate itself. Now it can actually pick up its head and it doesn't rub its nose. When you hold a baby in ventral suspension, the baby can pretty much keep its head to the plane of the body for a short period of time. So if this would be the head, this is the plane of the body, the baby would be able to do this for a little while, and then it would get tired and go like that again. In the supine position, the baby will be in a tonic neck reflex still, but a little bit more relaxed, not as contracted. It will follow a moving object as far as visual is concerned at 1 month of age. By 2 months of age, it will be able to lift its head and its chest from the exam surface, and now it can keep its head on the plane of the body for a little bit longer period of time before it gets tired. The tonic neck reflex is still available there, still present, and there is head lag. Head lag will go away in the next couple of months, and that's an important one to remember. As far as other things, look for what's called the social smile. That usually shows up at around 4 to 8 weeks of age. That's an important one, that's why it's in bold. The baby will have what's known as a social smile. It also makes cooing noises at that age. At 3 months of age, it can lift its head, its chest, and the arms will be extended on the exam surface. So that means it's almost ready to roll over. Rolling over usually occurs at 4 months of age. It can lift its head above the plane. So now, rather than being like this, the head can actually move up a little bit higher than the plane of the back. Tonic neck reflex is still visualized or seen. The baby will start reaching towards objects, and there's less head lag noted. And now we have more of a sustained social smile. Sometimes the babies will start to cry when you stop playing with them, particularly at 4 months of age. At 4 months of age, now you start losing that head lag. And the head, as you pull the baby up, the head will come up, will stay vertical. When you pull the baby up, the head follows with the baby. The baby will now be bringing its hands to the midline. That's an important one, because the fact that the baby can hold its head up better, the fact that the baby is putting its hands to the midline and bringing it up to the mouth, that's a nice indicator to maybe start some supplemental foods for the baby. It's a developmental stage. There is no head lag by 4 months of age. That's something to remember. Again, at around 4 months of age, they'll get a little bit upset if you're playing with them and you stop and they still want to play. They'll cry. Now we skip to 6 months of age. If you'll notice, these milestones are pretty much at the same time, at around the time that we're examining babies for routine health supervision visits. And that's one reason we do that, so that for them to get immunizations at the same time to be able to chart their developmental growth and development. By 6 months of age, the baby should be rolling over both ways. So at 4 months of age, they roll over from their stomachs onto their backs, and by 5 months of age, they start rolling over from their backs onto their stomachs. So certainly by 6 months, that's the cutoff, they should be rolling over both ways. They can pivot, and they can start to creep and crawl. Now, creeping is basically the baby on its tummy pulling itself along with its arms and legs. Crawling implies that the baby is now using its legs in helping to propel itself. Remember rolling over, okay? The baby will, another important milestone is sit with a kind of a rounded back and pelvic support. So it's starting to sit up. Again, these could be like abuse questions, what the baby's doing or not doing. Another way of presenting it is a baby with cigarette burns on its buttocks, and the parents say that the baby sat on them and is 6 months old. Well, the baby's not really sitting up all that well at 6 months of age. Suspect abuse. The baby will turn its body to extend its reach at 6 months of age, and it does prefer the mom at 6 months of age as far as social interaction. At 9 months of age, the baby can sit by itself without any support, and the back is very straight. It will start maybe walking with the hand held. Again, remember that this is a spectrum. Some babies are sooner than others. And certainly, remember what's known as the pincer grasp. That's the ability to pick something up between your thumb and forefinger. The baby will play peekaboo. It also will say dada. It says dada before it says mama. It doesn't know who the dad is or who the mom is. It just says dada. But the dads feel real proud. Around 1 year of age, the baby may be cruising or walking. Cruising means that the baby is hanging onto the table or whatever, or the couch, as it tries to walk around. And then they might let go and it kind of plop down again. That's called cruising. It can walk with one hand held. Again, it can release something on when you ask for it. It can release it into your hand. And they may start using some words. Thankfully, around 1 year of age, they will adjust their position for dressing, so it makes getting the clothes on the baby a little bit easier. These next ones for development, you need to know your towers, okay? And the way I remember the towers of the cubes, or the blocks, is that the first one is at 15 months of age, and that's when they do 3 cubes. They put one on top of the other. At 18 months of age, they will do a 4-cube tower, and at the next visit would be 24 months of age, and they would do the sum of the first two, which would be 3 plus 4 is 7. They would do a 7-cube tower. So that, again, is information that they'll throw into the stem of the question, saying that the baby can do these things. Around 15 months of age, babies will be pretty much walking on their own. All of these developmental milestones are very important because it also helps with anticipatory guidance and safety issues. For example, at 6 months of age, we know that the babies are rolling over both ways. We know that they're going to start crawling. We need to start talking about child-proofing the house and, plugging up all the outlets and things like that, putting up fences so that they don't fall down stairs. And so it's very important as far as safety issues. So once we know that they're walking alone, we need to know that ahead of time so we can give anticipatory guidance to the parents about safety issues. A 15-month-old can indicate some wants by pointing at things. The 18-month-old will start to run. They can also walk down some stairs with their hand being held. So again, a safety issue. They will be able to feed themselves around 18 months of age. They will handle a spoon sometimes. And they have about a 10-word vocabulary. They will point to some body parts, and they certainly know how to say the word no. At 24 months of age, they're running up, and they can go up and down the stairs with their hand held. Later on, they'll let go. And again, safety issues. Like I said, at 24 months of age is a 7-cube tower. Please just go out and pick certain items in each category at each age and learn those. If you have a child and you remember what age your child did things, that's a real advantage. At 24 months of age, they can handle a spoon very well. They will help to undress. Now, 2 years, 2-word sentences. That's a little clue there. They can start putting a couple of sentences together. At 30 months of age, they'll start walking upstairs, alternating the feet. What does that mean? Is that before they would put one foot here and then the next foot would come up to the same step. What they do now is they put one foot and then the next foot goes to the step above it. So it's called alternating feet, walking up the stairs. And up now we're up to a 9-cube tower. At 30 months of age, they actually refer to themselves with the word I, and they can start to put things away. Sometimes that goes away at adolescence. They don't put things away after that. At 36 months of age, they will go down the stairs alternating feet, and they will know their age and their sex. They know that they're a boy or a girl, and they can tell you that they're 3 years old. It's hard to say that TH, but they'll tell you that they're 3 years old. And they can also start learning to take turns. 4 years of age, a cross or a square, 4 sides. 4 years, 4 sides. They can count 4 objects. So that makes life a little easier if you remember it that way. And at 60 months of age, they can actually skip down the hall or down the street for you. So again, try to pick out certain things. You may get a question that says a child does these things, what age is he? Or you may get a question that has that information in there, and you have to decide, is this appropriate for this child age or not? This is a baby that they're pulling up, and you're actually looking for the absence or presence of head lag. Here's a baby that's doing some tripod sitting around 6 months of age. His back will be a little bit rounded. This is the pincer grasp, the ability to pick something up between the index finger and the thumb.